Tuberculous osteomyelitis. It is usually solitary focus, but in the HIV patients, it may be multifocal. It is more destructive and resistant to control than the pathogenic osteomyelitis. More commonly, it is seen in the adolescent or the young adult in the developing country. The source of the infections may be pulmonary or the extrapulmonary tuberculosis. Predisposing factor is like diabetes mellitus, elderly patients, immunocompromised patients, and general debility. Then the route. Most common route is the blood-borne route. Then it's also maybe occur by the direct extension from the another sides of the body. In case of the blood-borne infections, it may come from any of the focus from the pulmonary or the extrapulmonary tuberculosis. But in the direct extension, it comes from the lung, then from the ribs, and going to the bone, and from the tracheobronchial node, it going to the adjacent vertebra. So from lung going to the rib, from tracheobronchial node, it going to the vertebra. Site of the action, it may attack the spine, thoracolumbar vertebra. It's called the Pott's disease, or it may affect the intervertebral disc. Then multiple vertebra will be affected, and will extend down. Now infect the soft tissue and causes the abscess formation. It's called the cold abscess. This cold abscess is also known as the psoas abscess. In some cases, it will also affect the knee or the hip joints. Microscopically, we see there is a dead bone which is surrounded by the tuberculosis granuloma, where the central area consists of necrosis and which is surrounded by the epithelioid cells and Langerhans giant cells. The epithelioid cells have the nucleus which is oval or the elongated in the shape and having the pale pink cytoplasm with the indistinct margin, often merges to each other and to form the Langerhans giant cell, and now it is which is surrounded by the lymphocytes. Clinical course of the tuberculous osteomyelitis. There is low grade fever with the evening rise temperature. There is pain when there is motion in the joints. There is localized tenderness and there is weight loss. Complications. When it will attack the spine, there causes the destructions of the vertebra. There is psoas abscess formation. When there is tuberculous osteomyelitis formed in the TB, they will causes the compressions on the spinal cord or the nerve, and it will causes the scoliosis or the kyphosis. There is neurologic deficit will occur. Then the psoas abscess formation. When it will causes the infections in the spine, they will also causes the infections and the rupture of the soft tissues anteriorly. Then pus or the necrotic debris now drain along the spinal ligaments and causes the cold abscess formation. This abscess is not seen in the acute inflammations. When the osteomyelitis occur in the lower lumbar vertebra, then they will causes the infections and dissect and appear as the draining sinus of the skin in the inguinal region, and it is the first manifestations of the TB spondylitis, and it may also causes the tuberculous arthritis. There is also sinus tract formation. There is also amyloidosis.